The anatomy and physiology of the urinary system. Introduction to the urinary system. The urinary system has roles you may be well aware of. Cleansing the blood and ridding the body of waste probably come to mind. However, there are additional equally important functions played by the system. Take, for example, regulation of pH, a function shared with the lungs and the buffers in the blood. Additionally, the regulation of blood pressure is a role shared with the heart and blood vessels. What about regulating the concentration of solutes in the blood? Did you know that the kidney is important in determining the concentration of red blood cells? 85% of the erythropoietin, or EPO, produced to stimulate red blood cell production is produced in the kidneys. The kidneys also perform the final synthesis step of vitamin D production, converting calcidiol to calcitriol, the active form of vitamin D. If the kidneys fail, these functions are compromised or lost altogether, with devastating effects on homeostasis. The anatomy of the kidneys. The kidneys lie on either side of the spine in the retroperitoneal space between the parietal perineum and the posterior abdominal wall, well protected by muscle, fat, and ribs. They are roughly the size of your fist. The male kidney is typically a bit larger than the female kidney. The kidneys are well vascularized, receiving about 25% of the cardiac output at rest. The right kidney is smaller than the left. It also sits slightly lower to make room for the liver located on the right side of your body. The kidney's internal structure. A frontal section through the kidney reveals an outer region called the renal cortex and an inner region called the medulla. The renal columns are connective tissue extensions that radiate downward from the cortex through the medulla to separate the most characteristic features of the medulla, the renal pyramids and renal papillae. The papillae are bundles of collecting ducts that transport urine made by nephrons to the calyces of the kidney for excretion. The renal columns also serve to divide the kidney into 6 to 8 lobes and provide a supportive framework for vessels that enter and exit the cortex. The pyramids and renal columns taken together constitute the kidney lobes. Renal hilum. The renal hilum is the entry and exit site for structures servicing the kidneys: vessels, nerves, lymphatics, and ureters. The medial facing hilum are tucked into the sweeping convex outline of the cortex. Emerging from the hilum is the renal pelvis, which is formed from the major and minor calyces in the kidney. The smooth muscle in the renal pelvis funnels urine via peristalsis into the ureter. The renal arteries form directly from the descending aorta, whereas the renal veins return cleansed blood directly to the inferior vena cava. The artery, vein, and renal pelvis are arranged in an anterior to posterior order. Nephrons and vessels. The renal artery first divides into segmental arteries, followed by further branching to form interlobar arteries that pass through the renal columns to reach the cortex. The interlobar arteries, in turn, branch into arcuate arteries, cortical radiate arteries, and then into different arterioles. The afferent arterioles service about 1.3 million nephrons in each kidney. Nephrons are the functional units of the kidney. They cleanse the blood and balance the constituents of the circulation. The afferent arterioles form a tuft of high-pressure capillaries about 200 micrometers in diameter, the glomerulus. The rest of the nephron consists of a continuous, sophisticated tubule whose proximal end surrounds the glomerulus this is the Bowman's capsule. The glomerulus and Bowman's capsule together form the renal corpuscle. These glomerular capillaries filter the blood based on particle size. After passing through the renal corpuscle, the capillaries form a second arteriole, the efferent arteriole. These will next form a capillary network around the more distal portions of the nephron tubule, the peritubular capillaries and vasa recta, before returning to the venous system. As the glomerular filtrate progresses through the nephron, these capillary networks recover most of the solutes and water and return them to the circulation. Since a capillary bed, the glomerulus, drains into a vessel that in turn forms a second capillary bed, the definition of a portal system is met. This is the only portal system in which an arteriole is found between the first and second capillary beds. The portal system also links the hypothalamus to the anterior pituitary and the blood vessels of the digestive viscera to the liver. Ureter. The kidneys and ureters are completely retroperitoneal, and the bladder has a peritoneal covering only over the dome. As urine is formed, it drains into the calyces of the kidney, which merge to form the funnel-shaped renal pelvis in the hilum of each kidney. The hilum narrows to become the ureter of each kidney. As urine passes through the ureter, it does not passively drain into the bladder, but rather is propelled by waves of peristalsis. The ureters are approximately 30 centimeters long. The inner mucosa is lined with transitional epithelium and scattered goblet cells that secrete protective mucus. The muscular layer of the ureter consists of longitudinal and circular smooth muscles that create the peristaltic contractions to move the urine into the bladder without the aid of gravity. Finally, a loose adventitial layer composed of collagen and fat anchors the ureters between the parietal peritoneum and the posterior abdominal wall. Bladder. The urinary bladder collects urine from both ureters. The bladder lies anterior to the uterus in females and posterior to the pubic bone and anterior to the rectum. During late pregnancy, its capacity is reduced due to compression by the enlarging uterus, resulting in increased frequency of urination. In males, the anatomy is similar minus the uterus and with the addition of the prostate inferior to the bladder. The bladder is partially retroperitoneal, or outside the peritoneal cavity, with its peritoneal covered dome projecting into the abdomen when the bladder is distended with urine. Urethra. The urethra transports urine from the bladder to the outside of the body for disposal. The urethra is the only urologic organ that shows any significant anatomic difference between males and females. All other urine transport structures are identical. The urethra begins inferior and central to the two urethral openings, forming the 3 points of a triangular shaped area at the base of the bladder called the trigone, tri for triangle, and the root of the word trigonometry. The urethra tracks posterior and inferior to the pubic symphysis. In both males and females, the proximal urethra is lined by transitional epithelium, whereas the terminal portion is a non-keratinized, stratified squamous epithelium. In the male, pseudostratified columnar epithelium lines the urethra between these two cell types. Voiding is regulated by an involuntary autonomic nervous system, controlled internal urinary sphincter, consisting of smooth muscle and voluntary skeletal muscle that forms the external urinary sphincter below it.